The Special Coordinator for the Middle East Peace Process ad interim, Sigrid Kaag, visited southern and central Gaza today. This is her first visit since the ceasefire started on the 19th of January. In Khan Yunis, she visited a newly built temporary learning space where 3,000 children get education, supported by UNICEF. Ms. Kaag also spoke with children and mothers at a nutrition center and a center focused on mental health and psychosocial support. The Special Coordinator has so far held several meetings in Israel and the occupied Palestinian territory and continues to engage the countries of the region. She also spoke earlier this week with Kaja Kallas, the Vice President of the European Commission, about the situation in the OPT. Meanwhile, our colleagues from the Office for the Coordination of Humanitarian Affairs say that the UN and our partners are seizing every opportunity presented by the ceasefire to step up our support to people across the Gaza Strip. This includes increasing the flow of incoming supplies and deliveries, as well as scaling up storage capacity, repair work, life-saving services, and needs and damage assessments. OCHA says the UN and our partners are dispatching incoming supplies to designated emergency shelters and distribution centers across the Gaza Strip. We're distributing food parcels and flour and working to reopen bakeries. Yesterday and Monday, our UNRWA colleagues distributed 118 trucks of more than 53,000 food parcels to communities in Khan Yunis and to the UNRWA shelters in Deir el-Bala. The UN Population Fund says that yesterday, 20 trucks carrying critical supplies, including for safe births, emergency obstetric care, postpartum kits, contraceptives, and winter items, were offloaded in Deir el-Bala. 20 more trucks carrying UNFPA assistance are entering northern Gaza today. The UN Office for Project Services, UNOPS, is distributing fuel to ensure that critical services such as healthcare and water pumping and desalination can run on backup generators in the absence of electricity. The UN and our partners are also supporting infrastructure repairs, including to water wells and desalination plants. Our humanitarian partners are carrying out rapid assessments in newly accessible areas to identify people's most urgent needs, including water, hygiene, sanitation, and healthcare. They're also stepping up disease surveillance efforts. We and our partners are setting up trauma stabilization points to handle emergency cases and are mobilizing specialized care teams. We also have an update on the situation in Jenin in the West Bank. OCHA warns that the ongoing operation by Israeli forces in Jenin is putting people's safety and welfare at risk, while destroying infrastructure as basic as roads, electricity, and water pipes. 10 people have reportedly been killed, with dozens more injured. OCHA warns that since yesterday, the Jenin government hospital has been disconnected from the water grid and electricity network. It relies on dwindling water reserves from emergency tanks that were installed just weeks ago in preparation for such situations, through an allocation by the occupied Palestinian Territory Humanitarian Fund, which is managed by OCHA. Our partners are set to refill water and fuel reserves at the hospital as soon as they secure access to the facility.